Hi, frozen shoulder, clinically known as adhesive capsulitis, is a condition characterized by stiffness and pain in your shoulder joint. Frozen shoulder occurs when this capsule thickens and tightens around the shoulder joint, restricting its movement. Your risk of developing frozen shoulder increases if you are recovering from a medical condition or procedures that prevent you from moving your arm. The bones, ligaments, and tendons that make up your shoulder joint are encased in a capsule of connective tissue. Unfortunately, I have developed frozen shoulder following my shoulder surgery earlier this year. With the gyms being closed during the coronavirus lockdown, my shoulder became extremely stiff and I could not reach my end ranges without pain. I'm sharing with you this banded joint distraction, which is a type of mobility technique that enables you to create more space inside your joint complex. Most of the joints that we use for movement and exercise are synovial joints, which contain synovial fluid that acts as lubrication between the articulating surfaces inside the joint. Anchor the resistance band around a secure rack or a pole that is elevated, and then wrap the other side around your shoulder. Make sure that it can securely pull your shoulder joint backward into retraction. Now walk forward until the band gets tight. If you are new to joint distraction, find an experienced coach to teach you this technique in person. Minor changes in the placement of the band, as well as in the position of your body, can make a big difference. So don't waste your time by doing it wrong or in a less effective way. You will want to make some minor adjustments in your alignment in order to find the position that works best for you. You want to feel the muscles of your chest and shoulder opening up, so take time to explore various positions and find an alignment that works best for you. Most focus on linear pressing and pulling shoulder movements such as overhead presses and pull-ups. Well, these exercises are great, but it is important not to forget about the crucial element in your shoulder movement, that is rotation. When your shoulder is lacking in rotational mobility, a number of issues can occur. The most common problem is probably impingement. If your rotational range of motion is limited and you are forcing through repetitive shoulder movement when you work out, it can contribute to more major shoulder injuries. I'm sharing with you this banded external rotation drill that can improve your lateral shoulder rotation mobility. The banded lateral distraction is a safe and effective technique to improve the mobility of your glenohumeral joint. And it is particularly suitable for those who have adhesive capsulitis. These patients, me included, often have restriction in multiple planes of motion. Since this is a general lateral distraction manipulation, it can help improve mobility in multiple planes of motion. From a purely biomechanical standpoint, we should expect improvements in horizontal abduction. Once you have found the best positioning, it is time to add a few cycles of contract and relax PNF stretching techniques. The combination of PNF stretching and joint distraction will do wonders for your shoulder mobility. This banded shoulder distraction drill is ideal for you if you have a limited range in shoulder flexion due to your shoulder stiffness. To maximize the effectiveness of the distraction force, you can slowly walk backward. You can then further improve your range of shoulder flexion with this banded mobility drill. Just to summarize the holy trinity of mobility, soft tissue therapy helps to restore the length to the soft tissues. Stretching helps to restore range of motion to movement patterns. And finally, joint distractions helps to improve the function of individual joints. These three techniques offer a powerful way to improve your mobility all on your own. If you like this video, please make sure you hit the like button, share and comment on this video. Please also subscribe to my channel, James Tang Fitness. If you do suffer from lower back pain, please take a look at my book, A Practical Guide to the Self-Management of Lower Back Pain, which is available from Amazon. Thank you so much for watching.